Mr. Levin of Michigan.
Thank you very much, Madam Chairwoman. I'm here. Yes, appreciate it. And I appreciate you convening this hearing on this super important topic. You know, I want to get very concrete about the difficulties of running a university or a community college during this pandemic. And as a Michigander, I want to mention the COVID-19 outbreak in East Lansing that's been linked to a popular bar near one of our great institutions, Michigan State University. As of July 6th, yesterday, there had been 170 confirmed cases, 170 confirmed cases of COVID-19 linked to this one bar restaurant, including 27 secondary cases, meaning people who did not visit that establishment but caught the virus from someone else who did. The entire Lansing region has been moved back into the high-risk category of our Governor Gretchen Whitmer's reopening plan, given the enormous impact of this outbreak. This is over just an 8-day period following that restaurant's reopening, and it has since closed again. I bring this up because it's a cautionary tale of the risk involved in reopening college campuses this fall. We can't just think about classrooms and dorms. Colleges anchor entire communities, restaurants, bars, stores, and so on. Cases of COVID-19 within a student body or faculty aren't going to stay within a campus's walls. Many reopening plans developed by institutions center around the need to test students, test faculty, test staff to contain cases of COVID-19 on campuses. However, estimates show that the testing capacity in most states is still far below what is needed to contain the virus. And in fact, the lack of adequate testing is the lead story in today's New York Times. Dr. White, when you decided to remain online for this fall, and as you say, perhaps the whole academic year, did testing capacity and possible scenarios like the situation in East Lansing play into that decision at all?
Absolutely, it did, Congressman Levin. I mean, Jiminy Christmas, when you have, we're responsible for well over 530,000 people with our employees and with our students, let alone, to your point, exactly what's happening in East Lansing and the communities where we're embedded.
And
we
did
came up with a number
faculty-
of, we came up with a number of $50 million a month to do testing on a routine basis, which is just not in the cards. And quite frankly, to your point is, if you test today and you're negative and it's an accurate test, that doesn't mean you don't pick it up tomorrow, right?
Right.
So we have gone to the notion of really anywhere from about 3 or 4% to maybe 10% of our courses are going to be in person. They're the laboratories, they're the healthcare training where they work on mannequins, et cetera. But everything else will be done in the virtual space because of the cost and the inefficiency, really, of helping solve this and keeping the disease under control for our students. But we have like 25% of our employees are, in their 60s and above. We're responsible for them.
And you consulted with faculty and staff when you made your decision as well, I assume.
Faculty, staff, students, local public health officials, epidemiologists, and infectious disease experts in the state government. Yes, broad consultation across the system.
Well, as you say, it seems like you could easily see what's happening in East Lansing play out at any college ball in the country, or even at a party, on a campus anywhere. So let me ask Dr. Pierce, if we improved testing and stood up a nationwide contact tracing program, do you think school administrators like yourself around the whole country would feel better equipped to reopen, knowing there's an infrastructure in place to contain outbreaks? I'm talking about, Dr. Pierce, the federal government fully taking responsibility, saying we will have a national contact tracing and testing program in place. Would that affect your decision making?
I believe it would. I think that, we follow the guidelines provided for us by the state of Minnesota, the CDC, and the Office on Higher Ed, but having a robust screening and testing policy and practice in place would certainly play into our total decision making and make us feel a lot safer about welcoming our students to campus. You know, our whole guidelines are based on the health and safety and employees, and so anything that would enhance that would be welcome.
Thank you so much. As I hear, Madam Chairwoman, my time's expired. I'll just say that I feel so badly as a member of Congress, which is supposed to govern our whole country, that we're putting these wonderful administrators of our great universities and community college into this position of having to deal with this pandemic when we're not providing the national infrastructure of public health that we're capable of providing. That would help them so much. And with that, I yield back.
Thank you, Mr. Levin. Mr. Klein?